Manoj Kumar, rest of the HODs, and doctors and faculty members. Doctors are also here. From all faculty from all medical colleges. Well, this is a very sensitive issue today. When I was doing my MBBS, the entire world was managed by Septran. Septran, you know, we all know Septran. And if our teachers felt that this Septran would not be, sulfa groups of the drug would not be adequate, then they tend to write tetracycline. This was during my MS training. When I got into MS, the era changed. And it was the era of ampicillin. Subsequently are followed by the combination of MP and cloxacillin. Within 10-15 years, because of the rampant private hospitals and because of scareness of infections following surgeries in particular, and in critical patients, in order to circumvent the secondary infections, the antibiotics per se have been abused so badly in entire globe, not only in India, that today the 16% of multi-drug resistance is witnessed in India itself as far as the tuberculosis, only tuberculosis is concerned. I think my figure is right. In the same way, in different diseases also, now the resident today following surgery, if asked to write antibiotic, he directly goes to the topmost antibiotic available today. He will not write something less than magnemycin, vancomycin, and different kinds of the combinations. There is a possibility that this may anchor, this may prevent the infection, but subsequently the guy does not realize that it is going to give a new birth to antibiotic resistance. And it has happened with me also. I was a young, robust, dynamic practitioner of neurosurgery in government, never in private, sorry. Practitioner words does not apply probably to that. I had been a dedicated neurosurgeon. And one person, young couple, came to me with a sick child of 3 months. 3 months child had overwhelming fulminant post-meningitic hydrocephalus, and somebody installed a shunt on him. The poor guy has sold his properties in order to take care of his son and in order to get a good treatment. Because the hospital which referred him has prescribed 21 drugs, including nearly 15 antibiotics to that small little kid. You can think over. The 5-6 kg kid was prescribed 21 medicines, yet there was no respite. Somebody told this guy, he came from Kanpur and I was in Lucknow, that you meet Dr. Rajkumar, and subsequently he landed up there. As per my practice, I never encouraged to take the operated cases from other hospitals because I felt it insulting that somebody else operates and refers back to me in order to dump the patient and save his or her name or his hospital's name. But this guy caught my feet and he did not get up till I said, okay, you get your child here. I studied entire record. The shunt failed 2 or 3 times, and it did not take too much of time to understand that probably it is the abuse of antibiotics and infection could never be addressed adequately. So CSF remained always infected, and installation of shunt obviously might have resulted into failures. Because if infection is there in CSF, whatever you do, the hardware, whatever you install is not going to survive. Because CSF probably is the one fluid in body which is most vulnerable for infection. And infection once occur, it's very difficult to treat it at time. People die because of meningitis, encephalitis, and no antibiotics works. Now, why I am telling this story to you? I, as a very primitive and very mindful and thoughtful neurosurgeon, I stopped all antibiotics and I just treated this child on ampicillin, gentamicin, and metrogyl. Stopping all 23 drugs, I treated this child in this era only. I am talking about this era. I started him on Cefa group of drug, gentamicin, and for anaerobic infection, that small dose of metrogyl. This continued for 3 weeks. After 3 weeks, the culture of CSF came sterile. It became sterile. You think of highfalutin last generation of antibiotics, no effect, and I treated on basic antibiotics, the CSF got sterile. Because I knew it that the people outside are using the last generations of antibiotics, and these antibiotics might never have been tried on this child. As usual, as per my protocol, and I have written it also, it's available on literature, globally used also. 12 weeks I continued with the same antibiotics and I reinstalled the shunt. I remember at least for 2.5 years, the family was very happy. Shunt was never failed. Shunt is one of the operation which is the worst operation in the world of neurosurgery. In entire neurosurgery is one of the worst operation. It has thousands of complications. Shunt block, shunt infection, shunt disconnection, lower end failure, upper end failure, infection, hemorrhage, you name any, up to adult age even. But after so many infection, after overwhelming infection, after so many antibiotics, the basic antibiotics worked so well that the child was all right even at the follow-up of 1.5 years or so. I don't know what to do at this juncture when we are in order to have very good results, and all are clinicians here, so I am trying to give this message to you, and this message must be passed to next generation that always these highfalutin antibiotics are not required for the patients. On one hand, the expenses are too much. On another hand, the resistance is invited. On other hand, you are exhausting the human body because more and more vigorous antibiotics, unwanted antibiotics, different combinations of antibiotics, ultimately it is human body, it's not guinea pig where you are experimenting. It's a human body. And every drug or every foreign body, after all, what are these drugs, what are these antibiotics? These are also foreign materials to us. These have been studied and it has been concluded that that's okay for this particular thing, this is the drug, but it does not remain devoid of its side effects. Side effects may be less for rest of the body. These are effective for particular system, that is okay, but it does not mean that the rest of body is immune for these things. So I think the topic is very pertinent, and I think something must be resolved during these meetings, and some protocols ultimately can be made at state levels. Like we had at SGPGI. SGPGI, you know, is quite well known and premier institute of North India. We had a protocol for antibiotics in our department also, because if you leave everybody to write anything, whatever you wish to, is not going to a very streamlined system. This would be a biblical practice. So what I suggest, every department should formulate its antibiotic policy. How does and how can it be formulated? It is also easy, because you are clinician, so I am trying to tell. In my department, we formulated antibiotic policy. How? Simple case, young patient, no comorbidities, one antibiotic. One dose of antibiotic preoperatively, maximum one dose of antibiotic intraoperatively, one or two doses following that. If patient is second time surgery, 2 days prior antibiotics, 2-3 days post-operatively. If the patient is diabetic above 60, I have subsequent protocol. If the patient has more than 2 comorbidities, I have subsequent protocol. If the patient is suffering from autoimmune disease, I have subsequent protocol. If this way the things are defined, probably the misuse of antibiotics can be stopped. This is one way at the level of clinicians. Rest, the infection policy of institute, ICU infection policy of institute must be formulated at every institute, at every medical college, in order to prevent such a disaster which is going to be witnessed in very recent future. So it's not only the responsibility. One day when I was, how many minutes do I have? I am exhausted, but when you know my weakness, when I start, no, but this is my problem. This is my problem when it comes to my hand. Even my batchmate says. So I forgot I wanted to say something. But anyway, so I think the bottom line is this, that the misuse, overuse, underuse of course is also fatal. I don't say that for the sake of becoming a great person or to be labeled as a great person, one should not use whatever is required. But overuse of everything is bad. Buddha said, no, everything whatever is excess with you is worse, is going to give you pain. Whether it is wealth, whether it is a materialistic world, whatever, everything, whatever is in excess, that is going to result into suffering to your body and probably to your family and ultimately to society also. So I think this is the need of our, and of course the pharma companies and the entire research on these things, new generation antibiotic, they present before you in such a lucrative manner that you sometimes lost that boundary as to which antibiotic could be better. You go by the advice of that fellow who is interpassed and he has been trained to mug up all those things which he tend to tell you. If you ask even 2 questions to that medical representative which are thoughtful and which have logic, वो बोलेगा कि सर हम पूछ के बताते हैं, I have no idea about it. And the same guy giving you a pen, giving you a sometimes shirt if he knows your measurement, and these things happen. And in my practice, believe or not, for 10 years I did not allow MRs to come in my chamber. It was my junior who was head of department of neurosurgery at KGMU. He one day fired me कि सर आप तो कॉन्फ्रेंस कर ही नहीं पाएंगे. I said why? कि हम वहाँ एमआर को कन्विंस करके भेजते हैं कि कुछ दे जाए, आप उसको गाली दे के भगा देते हो, तो आप कॉन्फ्रेंस कैसे कर लोगे 1 करोड़ रुपए की? It was a big conference. neurology and neurosurgery. It was the first biggest conference of SGPGI. Subsequently, there had been others. Dalai Lama was our chief guest. So, everything is possible. It is the willpower and wisdom. Willpower and wisdom is something which does not come overnight. If I start talking about wisdom, it will take too much time. Thank you very much.